It's my great pleasure to welcome my friend and co-convener of this conference, Patrick McGorry. Pat, you know, people say so-and-so needs no introduction, and it's a bit of a cliche, but I'm afraid it is true with Pat. He does need no introduction. He's been one of the intellectual innovators and pioneers of early intervention and service reform for young people. And I found out only last night that, Pat, I think you were born in Wales, is that right? Or grew up there in Ireland, yeah, but grew up in Wales, I think. And when he came to the conference, took a long journey down to Swansea to watch the football. And after a very long journey from Australia, but unfortunately Swansea were beaten 3-1 by Arsenal. So we do need to cheer this man up, so let's give him a big reception. Thank you.
Well, thank you, Max. I think it's a bit of a segue between the last couple of talks. I might explain that. I did grow up there, but I have not been back there for a very, very long time, and it did give me a great chance to actually connect with the sort of themes that you heard Justin and Jeffrey talking about. And I thought it was a great preparation for this meeting, actually, so hopefully I can cope for the rest of the meeting. What I want to do is basically build on the power, and I think the sensitivity and sophistication that you saw in those first two talks about where young people are actually at and what they're actually going through, and shift the focus to the theme of the conference, which is young people at the forefront of services. And so hopefully I'll be able to do that. So as we've been trying to say, youth mental health is a sleeping giant, and we think it's actually starting to wake up, and we certainly hope that's the case. And we think it's a really good investment. So we think it's actually going to be a very good thing for society as well, not just for the young people. And this was exemplified, I think, with an important paper a couple of years ago in the journal Nature, which talked about the mental wealth of nations. And what they mean by that is that the social capital that actually comes from investing in young people from childhood right through to the threshold of adult life, wherever that is, whether it's in the late teens, early 20s, or late 20s, even as Jeff was just saying. But if a young person develops mental ill health during that period, and it's very, very common, some estimates are up as high as 80% of young people will develop a period of mental ill health, probably more conservative is about 50%, but it's still a big number to the extent that it's like an expectable thing to happen. If that happens, and especially if that results in premature death, which is obviously the most tragic and terrible outcome, or even in more persistent disability, or maybe at the other end, just failure to really achieve your full potential and contribution and fulfillment in life. That is a sort of a social tragedy, really, and a preventable one as well. So that's what these people are talking about when they talk about the mental wealth of nations. And you can see that, another idea that's around in this space is and this is from Richard Eckersley, an Australian I guess you could say thinker. He's a deep thinker about society. He refers to young people as the miners' canaries of society, meaning that they are the ones that are going to pick up the toxic effects of modern society, the ill effects of the way the whole culture and society are actually going. I think Jeff alluded to some of that in his talk. The concept of NEETs, the not in employment, education or training problem that Jeff alluded to, is an example of that. But there's lots of other things too, and I don't know whether you believe this idea or not, but it's certainly something that might explain this, the increasing or the apparent increasing level of mental ill health in young people. This is probably the most important picture to bear in mind, and this is the pattern of ill health or illness across the lifespan. And you can see that for the over 50s, it's not very good news. There's lots of nasty physical diseases, in prospect there. And for little kids too, there's a lot of physical illnesses that we need to take seriously. But between puberty and, let's say, middle age, but at least the mid-20s and late 20s, it's a period of incredibly good physical health. Young people have never been physically healthier in human history than right now. But it's arguable that maybe their mental health is worse than it's ever been, and it's certainly the biggest contributor to their health problems, mental ill health and substance use problems during that period. And you can see the pattern of it is quite different from the way we design services. As Jeff said, we basically have pediatric-style services for children and mainly younger adolescents. And then we have this kind of huge gap between then and when the mental health services generally kick in for older adults, and they're much more comfortable with that age group. So we've got a massive problem. We haven't invested any resources in this area at all, and the resources that are there are really not well designed, as I think Justin was alluding to. So we've got a big problem. Even the World Economic Forum is onto this. They basically assess that mental illness, mental ill health, is going to be the equal first contributor to GDP erosion, gross domestic product erosion, by 2030, along with cardiovascular disease. And the reason for that is the timing and the life cycle that mental health actually strikes. People on the productive threshold of life. You know, cardiovascular disease affects people in later life, so it doesn't have the same economic impact as mental illness and mental ill health. It's a very crucial argument for us to use in dealing with policymakers and politicians. And yet, you know, despite all of this, this is what we see. This is from the National Mental Health Survey in Australia about 5 years ago. It's being addressed, as I'll show you in a minute. You know, help is not sought by young people because either it's not recognised as a need for care by them or by their families, or when they do seek it, and this is probably the more common problem, it's denied. You know, it's the Groucho Marx situation. You actually get into the service and you realise it's not a club you want to be a member of. Or you're just not able to get in, you're not able to get access to decent care. So 13% of young men and 31% of young women with a diagnosable need for care with mental health problems are not that's the only proportion that actually get into any type of health care, which is a huge scandal, really. So this is the sort of message that they get, you know. And you know, and we have our great messages about early intervention, but actually when you go looking for early intervention, you get this kind of reaction from the wonderful triage systems that we've set up in our mental health services. Okay, so I probably don't need to dwell on this too much because you've heard some very beautiful descriptions of this. But the big challenge that we have in mental health, and I don't know if we can solve this one because it's a big intellectual challenge for us, and you see it reflected in the struggles of Headstrong and Headspace and Origin and the sort of services that we're trying to develop. How do you put together the positivity that you heard from the earlier speakers, the normalization type thinking, the anti-stigma thinking, and the resilient sort of mindset, the strength-based perspective, which is absolutely vital, and I think Jeff showed why it's so important. The optimism of young people is a real asset for us, really. How do you put that together with, you know, recognizing when people are really in need of help and serious help? So that's a big challenge, and people often go one way or the other. They go down the resilience track, the mental health well-being track, or they go down the serious mental illness track. We've got to bring that together somehow, and it's up to us to do that. Now, I'm drawing on, I just want to highlight this organisation from Australia, founded by an Irishman called Jim Steins. It's the Reach Foundation. It's incredible the way it taps into the resilience and just strength of young people, even young people with very, very difficult lives and very major challenges. So the resilience approach is really important. The other person I want to thank and mention here is David Shires, who's in the audience. He was one of the key contributors, along with Max, in terms of the early intervention reforms in the UK. And he has got a tremendous amount of common sense and humanity. And he describes the fact that we're all living in a swamp, basically. And he is English, you know, so you can sort of understand it. But what he actually means is that he's living in an environment, in a society where people get distressed, they have problems, they have persistent, difficulties of various kinds, and they don't use technical terms from the DSM-5 to describe them, surprisingly enough. They use these sorts of terminologies, and he makes the point that people have needs before they have diagnoses, and that was the whole controversy about DSM-5. Are we labelling things in a bad way or in a not a useful way, I suppose? And we've got to do that, and I think Justin's talk exemplified that too. We've got to be able to listen to the words of young people when they are struggling and get them to sort of help us and get them to help recognise it in a different way. And then all the other diagnostic stuff can follow that, actually. And so we've thought a lot about this, how to do that, how to make sure we don't miss out on being able to offer early intervention for potentially serious emerging mental health problems without actually mislabeling or causing harm through that process. And the staging idea is one possible solution, which is basically to recognise that the need for care precedes the capacity to apply the more traditional diagnostic terms like schizophrenia or bipolar or even severe depression and these other sort of terms. They may be useful at some point, but not in the early stages necessarily. So we've got to find a way of responding in a more in a way that doesn't harm people, that actually is stepwise and graduated, so that we actually provide effective help without actually harming people. And this is a challenging thing to get our heads around. We've struggled with this for a long time in mental health care. Okay, and that leads into the whole idea of early intervention. And again, I've got to thank our Norwegian colleagues, Jan Olav Johannessen, for this slide, which actually shows what's really happening in traditional mental health systems around the world. The white figures at the bottom there, coming on the scene late in the piece with very damaged people, people that could have been helped much earlier, and missing a whole lot of people that don't get any help. And really, all the ambulances are at the bottom of the cliff, not at the top where we need to be. And so this tension between a lack of resources, the wrong mindset, and actually, you know, what's really happening. That's a big problem to address. In the early psychosis, the early intervention psychosis world, that has been addressed consistently by many people in the audience. Many of the leaders of that movement are in the audience, and they're part of this youth reform too. And this has been a 20-year evidence-based reform process across the world, which we're now trying to broaden, I suppose, through this process. British research, you'll hear from Martin Knapp tomorrow about this, that it's highly cost-effective, not surprising. Intervening early with treatable serious illnesses is a good idea, just like it is in every other part of healthcare. It's contested by critics, but actually this evidence base is one of the best evidence bases in psychiatry. And here are some of the critics. It's one of the things that we have to deal with. If you're actually making real change, and we have to accept skepticism is a really important part of our world. We have to be skeptical. We can't just accept things at face value on the basis of enthusiasm or passion. We've got to have evidence. But then even if the evidence is there, there's a group of people we can call denialists that actually try to destroy that evidence and actually reputations in the process. And that's the sort of thing you have to deal with a reform movement. You know, empowerment is one thing, but there will be a resistance if anything significant is being done. And doubt, I don't know if any of you have read this book, but this book explains, it's written by historians, how the introduction of doubt by scientists into an area where there should not be doubt is used quite strategically to protect vested interests of various kinds. So that's another dimension we have to think about here, without getting too paranoid about it. Okay, so just moving on now to what we actually need, and this is another debate that we have to have. I believe we need a new architecture, a totally new culture of care. We can't just patch up the existing systems. This is the patient's experience, the young patient's experience. That the current system is not really well designed to meet their needs. And some people have argued, well, all we've got to do is just patch up and strengthen the existing, you know, child and adolescent adult system, and that'll be fine, that'll do the job. That's the best we can hope for. It's what you could call the soft bigotry of low expectations, that argument. We can just accept that we're just going to patch up things. We've got to be realistic and accept that. Well, I don't think young people should be asked to accept that. And I think if they are our allies, as Justin was arguing, we need to draw on that power to help negate this sort of argument, I think. So what we've got to do is build something in between. It is an in-between thing. We've got to build something that's purpose-built for young people, and we need absolutely their help in designing that. And we are trying our best to listen to what they say, and definitely would pick up Justin's challenge to us to do that. It's been very helpful to us in Australia to go down that track, and we should go further down that track, actually. And, you know, so Chris Tanti, the CEO of Headspace, is going to be speaking about Headspace in more depth later, and Deb Rickwood, the research director too, so I haven't got time to go into much detail here, but the concept of Headspace has really been very rapid innovation in Australia. It began in 2006, and it's expanding very rapidly. The concept is very, very simple. It's a one-stop shop. It's putting together the sorts of help, the sorts of professional help, and other types of support that young people typically might need with their major mental health and substance use issues. And you can see there's youth-friendly GPs, there's allied health professionals of various kinds, there's drug and alcohol, there's family support, there's vocational support. And then there's the other elements of e-health and community outreach and those sorts of things as well. So it's not rocket science, it's very simple, but putting it in the same culture and having the welcoming, positive culture of care, expecting recovery is what makes it work. And so these are some of the pictures. It's a one-stop shop. It's youth-friendly and it's free. That's the other important thing, that the financial barriers are not there to getting help. There will be 100 of these sites by 2016. There's currently 55. It's the most rapid scaling up process I've ever seen in mental health reform, and it's well supported by communities. It's not so long ago that communities would be campaigning not to have mental health services in their backyard. Now they're campaigning with incredible force to have a Headspace in their community. And that is a big turnaround. That shows that the stigma issue is definitely on the back foot. And Headstrong in Ireland, another inspirational program led by Tony Bates and Bob Ilbach, who are in the audience today, and backed by the One Foundation, Declan Ryan's One Foundation. This has been another great reform story, which you'll hear about at the conference too. It's been done with a much greater degree of difficulty because of the financial situation in Ireland, but nevertheless, they've been skillful enough to get really great support from the people that matter. So you'll hear about that too. And in Denmark, Chris and Wendy McCarthy, the chair of Headspace, have just been in Denmark, where Headspace Denmark has just been launched, and even Nordentoft from that program is actually here at the conference too. So this is very encouraging stuff. So my question to you is, where is it going to happen next? Where are these reforms going to happen next in a serious way? And obviously we're looking at North America here, but the UK is obviously, with Max's leadership, is actually, and Swaran Singh, who's in here too, we want to see it happen in many places. That is the way that this whole reform will flourish around the world, if there's international collaboration and mutual support like we're having here at this meeting. Okay, I won't go through the challenges because we're going to overcome all of these challenges, so there's no point in really dwelling on them too much, but they'd be very familiar to you, to any of you that have tried to do this sort of work. I've referred to the conceptual issues, the territorial issues, the vested interest that we have to deal with. Justin's mentioned stigma. We need great leadership. We need more money, a lot more money. We cannot just repurpose the existing investments. If we're going to deal with this, we've got to invest very heavily in it, and the return on investment will be very, very good. And I think we'll be able to show that with the right sort of research. And we need the right workforce. There's no point in young people turning up to services where the clinicians aren't very fond of young people. You have to really have that affinity for them and be able to work with them. And we do need genuinely a new mindset and a new workforce in our professionals. So just the last bit now, and I think I was inspired a bit by Jeff's talk here about the latent optimism in young people. I think we have to have that. Mental health has not had this type of thinking before. I mean, you might say it's just head in the sand stuff, but actually, having a positive attitude, having confidence we can actually succeed in these reforms and these ventures, but that we can actually change things, that's very, very important. It's also important at the individual level, tapping into that optimism that young people inherently have, even if things are pretty bad. You know, there is that kind of resilience and hopefulness that's there, and that's a big asset for us. And I agree with Jeff, there's got to be a plan to go with it, but that's our job. We can be in coach mode or support mode to help them develop that sort of plan. But that's not the way most mental health professionals think. They think about obliterating symptoms or, dealing with deficits. You've got to address those, but you've got to have a positive mindset which we can draw from them. And I think that's a great lesson that, from your talk. We do need a scientific approach. Now, apart from anything else, it's the best way to get it right, to understand what's working, what isn't working, to be able to convince other people that the actual changes are sustainable and appropriate and delivering. It's very important that we embrace the evidence-based approach, but not be imprisoned by it. And it can be actually used against us as well. So it's important to understand that whole game of evidence-based, evidence-informed reform, and we have to understand that very well. The economic argument, which is supposed to be what I was talking about, the cost-benefit aspects, we've modelled that, and it's looking very promising, but we have to do much more significant and serious studies to actually show what the return on investment actually is. We're very confident the logic is behind us, but we've got to actually show the facts as well. And I think, again, coming back to the other ingredients that are part of the solution, the voice of young people is really important, and Helen Coughlin and David Shires did a huge amount of work with young people a few years ago, and this is the end result of that, which will be launched at the conference here in Brighton, the International Youth Mental Health Declaration, which is a very simple statement of intent. What we're going to do, when we're going to do it, and what the measurements are to assess how we're going with this. So goals and targets about suicide, about access, and a whole range of other things. So very important document, which you'll see soon. The other big thing, which Justin gave a great example of, and he's quite right, I don't think anyone else could have mobilised the whole student body across Canada in the way that they did, but we have to mobilise the general public. We have to get the public to see this as a self-interest issue, and I think that's very easy. It's just that people have not spoken freely enough about it yet, but in Australia we have 4 million Australians affected every year by mental ill health, and they are actually very conscious about it now. I don't think this is going to be a very difficult thing to mobilise large numbers of the general public, but we have to do it. And then there's the politicians. And in Australia, we've been very lucky to have bipartisan support for these sort of reforms. And top of the list of reforms that politicians want to support in Australia is youth mental health. At the last election, we just had a federal election, and down the bottom there is our former Prime Minister, who was very supportive of youth mental health. At the top is our new Prime Minister, and that's him there launching the Coalition's election policy on mental health at a youth mental health venue in the west of Melbourne, one of the ones that we're actually associated with. And so we have bipartisan support for this. In their policy, the only new money that was devoted to mental health investment was in youth mental health. So that is the kind of thing we have to get it's not to say that nothing else is important, but we have to make it a priority because it's the thing that's the biggest hole in the system. So that's basically it. And I don't know if you could read that. It says, "So far, so good. Let's hope we win." So I'm not sure if it's good ending on a French note here, but we can't get too far ahead of ourselves, but we've got to have the confidence that we can actually do this. And I'm sure we can with the support and with the leadership of young people, actually, and with all of us working together in international collaboration around these things over the next 10 or 20 years. So thank you all for listening, and thanks for coming.